Hello, everyone. Welcome. I'm Malisa Carullo. I'm a naturopathic doctor. I'm part of the clinical team here at Metagenics, and I'm your host for tonight. I'm going to be joined this evening by Dr. Suzanne Gilberg-Lenz. Let's see. She might actually be trying to join us now. And this evening, we're not only going to talk with an expert OBGYN, but we have someone here to, here she is. Someone who's involved in women's empowerment and public education. She's a frequent expert in women's health on TV, in the newspapers, online, women's health, integrative medicine, and she often frequents the Drew Barrymore show where she is the chief medical correspondent. She's the author of the Menopause Bootcamp book, and tonight she's going to share her knowledge surrounding genitourinary health and probiotics. Looks like she's having a little bit, maybe it's me actually that needs some help with working the Insta Live here, but let's see if we can get her to join. Ah, there she is.
Hi.
Welcome, Dr. Lenz.
How are you? Nice to see you.
Yeah, same. Good to see you. I was just telling everyone how you're going to share your knowledge tonight on genitourinary health and probiotics.
Yes. Yes. Well, okay. Are we just jumping right in?
Sure. I just want to let everyone know that if they have questions, they can pop them in the chat. Let us know. Yeah, keep the dialogue going. Let us know if you're a practitioner, if you love Metagenics, why you love Metagenics. Maybe you're new to Metagenics and just interested in the topic. Either way, we want to hear from you. We'll try to get some questions to Dr. Lenz so she can answer them. I gave a brief bio about you, but I think that you're just a good advocate and you're so passionate about what you do that maybe you could just tell everyone a little bit about your background, your expertise, and why this topic is so important for you.
I'm a board certified OBGYN. I focus on gynecology only at this point, but I did do obstetrics for over 20 years. But I'm also board certified in integrative and holistic medicine. I have a background specifically in Ayurveda. And my biggest interest in the integrative world is actually in plant-based solutions. So I'm really, really interested in herbal medicine, and I'm really interested in how we interact with the environment. So the understanding of us as part of the environment is a really important part of the traditional holistic healing systems that I've been most involved in. And I think when I think about why the microbiome and all of that is so interesting to me, I think that's part of it, because it's literally an example of how we are synergistically existing with bacteria, and understanding of the massive influence that that bacterial population has on everything from neurotransmitters to hormones to absorption. Every single system of our body is impacted by our gut. And then we have these other microenvironments throughout the body. So, that's where I have a lot of interest, and that is why my relationship with Metagenics has been so interesting and fun for me, because it's a company that I followed for decades in my career. I really love that Metagenics is involved with, clinical research, like really doing the work to advance the science, because I'll just say it, like I can say it because I don't work for you guys. I'm an MD. A lot of times the criticism we get leveled at integrative medicine, functional medicine, and I don't really consider myself a functional medicine practitioner, by the way, but I can roll with those people. Is lack of data or lack of clinical data, or that they take bench research and the next thing, in which, for those not in the know, like bench research is like straight up scientific in the lab research. And now we're making a claim this happened with the bacteria in the lab, but if you take that, it will happen to you. And it's like, well, we don't really know that. Like, we don't have that data, but Metagenics has consistently worked to educate the community, including practitioners, very, very involved in serious education of the practitioners out there, and in advancing the science, doing the science and looking at how does this product work in the clinical setting. And so that's really important to me, because we're never going to have the power of pharma or the NIH right. behind us, but we can do the best we can and be honest about that. So that's just my plug about why I like Metagenics and working with you. And I'm like, we geek out. Like when you and I met in February, I mean, I was just like, oh my God, she's like, you are into the weird minutia like I am too. So I don't want to bore people, but that's where I'm coming from.
Yeah, no, I think everyone's loving it. We have actually a lot of practitioners joining, a bunch of people saying, Dr. Lenz is a rock star. I echo that. She is. And that they love bacteria, but we're going to talk a lot about bacteria. I do have questions probably to ask you in regards to like outside of bacteria and general urinary health, but I think that we wanted to focus on probiotics and just understand probiotics, like what are probiotics? And then also just before you go to that, just a plug, you mentioned how everything is like, going towards the microbiome and microbiome impacts the body. And it's so true. Like we've followed how inflammation is like underlying in so many disease states, but now like the microbiome and the bacteria are really getting like their fame right now, and as they should. So it's super cool. But
it is.
Yeah, maybe you can talk about probiotics a little bit and, just define what they are, their benefits.
Right. Well, I mean, so a probiotic, and this is great. A probiotic is basically the bacteria that we're discussing, and I kind of talked about that. The probiotic itself is a product that will help to replenish or replace bacteria in a particular area of our body. So we're talking about the gut. The fact is that we know, and we can just get to it because we're focusing here on genitourinary health. Because I remember when I first started looking at this, I'm like, I don't understand how I'm consuming this in my gut, but it's getting to my bladder and my vagina. But it is, because there are various mechanisms of action that help to move specific species to the areas that they need to be in. So the probiotic is just that. It is a product that we can consume orally. Sometimes we administer it other ways, but we're talking about these products specifically, like Ultraflora Women's, which you're consuming orally, and then it's very specific species that we know have been shown to help rebalance the flora in the area. So in other words, the microbiome. And that in turn will help to create the optimal pH where that bacteria and other beneficial bacteria can live and do their job, because they're doing jobs there. They are turning on and off levers all over your body to create the functions or to help support your body's function. So specifically when we're talking about genitourinary health, we know that the pH can get off, the microbiome can shift, and now you have bacteria that is not only not beneficial, but is deleterious. This can happen at transitional states in our lives because of our hormones, postpartum, when you're on the pill, perimenopause and menopause. And now it's leading to an overabundance of bacteria that we don't want to have, like, for instance, Gardnerella, which will encourage, bacterial vaginosis. It can help create a beneficial environment for things we don't want, like yeast. And it can encourage all sorts of symptoms that are unpleasant, but also actual infections. So the probiotic is it's sort of like the police of I don't know if that's really a analogy we want, but they are policing.
Go with it. That's good.
They are policing the environment and keeping the environment safe and in check, because there's always going to be something there that we don't really want, but we need these bacteria to live in harmony as much as possible. So that's what the probiotic is, and that's sort of why they're important in helping to restore or maintain a healthy microbiome. Because often people are coming to me and to you, if you're seeing patients, with a problem, and often a persistent problem. So let's just get into it, right? Like, I know if there's any practitioners on here, they all have had patients who have persistent BV and or yeast or UTIs. And it's really tough, because I am not here to say don't use antibiotics. Use antibiotics, but we don't want to have to keep killing. Antibiotics are like a shotgun approach. Like, it's going to kill everything. So you may have gotten rid of the deleterious bacteria, but you need to restore the milieu. You need to restore the milieu. So if you don't want this person suffering, and also calling you and coming in and driving you and your staff crazy, that's part of it, but mostly suffering, then we have to fix what's wrong. So the probiotics are one of the most important steps to creating an environment where health can thrive. That's what we're at. That's what we're aiming at here.
Yeah. And I'm just wondering how common it is in your practice. And I think that a lot of us forget about the population of patients that are postmenopausal. So do you see that a lot of women need support for general urinary support? And do you see it in both populations? Can you just speak to that?
Yeah, I mean, so I do, you know, I'm obviously well known for menopause work, but I see full spectrum gynecology still. I see,
Right.
you know, young teens to, you know, way postmenopausal. We definitely see a lot of this in perimenopause when there's a lot of hormonal shifting and there's essentially hormonal chaos going on. And for sure in postmenopause. And now, to be perfectly honest, using hormone therapy locally is the most powerful tool in the toolkit. There are going to be people who don't want to use it, can't use it. There's not really too many people who can't use it, to be honest, but there are people who don't want to use it. And I do see people who have allergic reactions or problems using some of these hormone compounds, especially the creams. But even if you're using that cream, having the extra support of the microbiome to, again, to re-acidify, because we want an acidic pH in that area, is so, so important. And also, once somebody, as I mentioned, once somebody is off to the races with infections or inflammation, it's so helpful to have the right bacteria there, so that now that bacteria is flourishing and replicating and helping, working synergistically with whatever treatment you're using, whether it's antibiotics or it's, you know, vaginal estrogen.
Yeah.
So I see it a lot. I use it all the time. I use it all the time. Any of my patients who are on here, they've probably been offered this, you know.
If there's practitioners online, maybe I encourage you to just pop in the chat, what do you use? It could be antibiotics, that's totally fine, you're allowed to put that in. Or if there's other natural remedies that you find help, that will give us a good idea, and we can maybe discuss how it would be different than using the probiotic approach, or how it would be good in combination, to use both of those together.
Right.
So
we're talking, there's so many aspects, as you know, and I mean, we don't have a lot of time to like get into the weeds about this, but you know, there's like there's the approach of like dealing with the biofilm, and
right.
There's again the approach of putting the actual bacteria there, and you know, one size is not going to fit all, but I do think that the probiotic approach specifically, I've just found it to be very, very beneficial, very easily tolerated, easy to do. And again, data driven, because that's really important. Like, I can't emphasize enough. Like, it's important for there to be science to support what we're doing.
Yeah. So for those of you online tuning in, we're speaking tonight about, actually in particular, Ultraflora Women's. It's a probiotic by Metagenics. It's 2 specific strains. They're both lactobacilli. We have Dr. Lenz. She's an expert in this field. And why, Dr. Lenz, lactobacilli in general? Why is that?
So this is a really good place to start, right? Because I think a lot of people do know about lactobacilli. So lactobacilli are a specific bacteria that grow in the body, and they are very much favored in the genitourinary tract. What do? They help to essentially to keep the pH acidic, low. That's what we want. The problem is that I think that people don't understand that lactobacilli, like everything else in the scientific and the, you know, the natural world, that's a large category, and not every strain is going to be tolerated or create the same benefits. So the 2 strains that are in this particular product, rhamnosus, and I always get it reuteri, right? Reuteri?
Yeah.
Reuteri. They have been demonstrated repeatedly, and you guys have pretty large scale studies. I mean, I'm talking like, you know, you've got like over a decade of data. I'm pretty sure you've got stuff that's over 1,000 clinical experiences, really showing the benefit of these specific strains for, first of all, being able to travel from the gut to the target area, because if it's not going there, it's not going to do what we need it to do, and to have this particular benefit of reacidifying and helping to create a more healthy milieu, because again, you can eradicate the problems, but if you don't put the beneficial bacteria back, you're going to be back. This person is going to be back with the same problem in a matter of weeks. And I think the other thing that's really cool is there's some interesting data showing that you can use this then as a prevention, but if you start to have recurrent symptoms, doubling up on the dose has been shown clinically to benefit and diminish the risk of it recurring as an actual infection. So this is a really nice way to put some agency back in the hands of the patients. Because again, when you're talking specifically about BV, oh my gosh, people, by the time they come in, or a lot of times when they see practitioners like us, they've been to many, many doctors. They've been treated many, many times. BV is notorious for being recurrent, for being resistant to antibiotics. And I mean, how many antibiotics can a person be on, right? It's going to mess their belly up. It's going to mess up their skin up. It's going to mess other things up. And it's really not fixing the problem.
And a quality of life issue for
Oh,
the
yeah.
people.
Oh my God. Burning, itching, sexual dysfunction, odor, just, copious discharge. It's really problematic for people.
Yep.
So it's not just like a punchline. It's really anybody who takes care of people who have some of these infections and vaginal overgrowths. It's really disruptive, very upsetting, very upsetting.
Sorry, as Dr. Lenz mentioned, I just wanted to touch on that research, because you're right. We have a bunch of large-scale studies in different patient populations, young females, postmenopausal. It's these two strains in combination with antibiotics, against antibiotics.
So the really amazing stuff. I mean,
we're not saying, if they do come in with an acute UTI, don't use our antibiotic.
No.
We're saying we can use this in combination. And what we're seeing is that we can reduce antibiotic resistance in these patients with recurrent infections. And as Dr. Lenz mentioned, we could actually help the prevention, like shorten that duration of the infection, and then also not so much prevention long term, but for the next couple infections, what we can do is shorten how long they might last, or in the intensity.
Yes.
The intensity.
Yes, exactly. And I think somebody was asking, do you take it at the same time? Yes, you can take it. You would take it at the same time as antibiotics. So it's not going to interfere with anything else that you're taking. It's not going to interfere with anything. It's basically safe for anybody, unless I guess they've had an allergy to something like this. And I think the other thing I'm thinking of too, is we're talking about this, is like special populations, right? So people, for instance, who are diabetic or have other immune compromise, who are going to be more susceptible to infections, to yeast infections. This is a really potentially powerful tool to help diminish their risk of having these problems. I mean, obviously we want them to manage their whatever the underlying condition is, but this is a nice tool that's safe to use. It's not yet another medicine that's going to have another side effect or interact.
Right.
And I think it's, and I do think, again, I can't say enough that I think patients feel really disempowered when they have these kinds of problems. They feel gross, they feel embarrassed, they feel uncomfortable, they feel defeated. They've talked to us multiple times. And this is something that we can put in their hands that will have an impact positively on their health and on their life.
Absolutely. And our patient surveys did represent that. The results represented that. A number of females, were not seeing recurrent infections for quite some time. But they just want to continue the formula because, again, they knew if one came along, it would impact their life. We have someone asking if this could be used in men.
I mean, I don't know any data. I don't know that we've looked at it. And of course, we do call it ultraflora women, which I guess, and we probably need to think about that just in terms of pronouns and stuff like that. But just, medically speaking, I'm not aware of data in men. I don't treat men.
Right.
I don't have any advice for men.
Yep.
I can't see why this would be problematic.
Yep.
I really can't. But there's not, I mean, I can't answer that.
Yeah,
I'm just
so
gonna stop there.
We don't have the valuable clinical data that and the abundance that we do for women, but anecdotally, absolutely, it works so well. Because again, if we think about that microbiome, and when there's a disruption, there's a disruption for women for all different reasons, right? Tissue, as they age, thins, but then also blood sugar disruption when the microbiome is disrupted. So if we think about that in men with prostatitis or infections, absolutely, it works wonders.
Yeah, absolutely. Although it's interesting, and this is getting into the weeds a little bit, but semen has a much higher pH. So so we know that because it can mess with women's pH if they're having, penis kind of
Yeah.
sex. So I don't know what to tell you. That's an interesting question. Now it's going to make us go down the rabbit hole and look.
Or
Yeah.
find someone who wants to do some research with us.
Yeah, exactly.
We're
Maybe
always
that
looking
person
for
wants to
that.
do research. Reach out to Metagenics.
Do you use other natural formulas like cranberry, uva ursi, D-mannose?
Yeah.
Awesome.
Yeah, I
Can you
do.
tell how those work differently, or
I
would
mean,
you use them in combo?
they're acting at a different level, right? So as we discussed, putting the actual bug there is it's doing its job, right? The job of the cranberry extract, and it's really important, it's not cranberry juice, it's cranberry extract. And D-mannose, that's having more of impact, as far as I understand, on basically the stickiness, essentially, of the bacteria to the tissue.
Mm-hmm.
So it's creating difficulty, its adherence of the deleterious bacteria is impaired in that tissue.
Yep.
And there's some interesting data on this. And I think for somebody who's really having like serious issues with recurrence, so that would be more than 4 episodes in a year, that this is a wonderful tool to add in. I like both because they're doing 2 different things and you're hitting the problem at multiple levels. With, again, people really aren't getting side effects. There's not untoward effects from these medications, or these I mean, they are medications from these pharmaceuticals, these supplements. There's not a lot of people who can't use these things safely. So, safe, effective, nice, easy to use.
Yeah, you hit the nail on the head there. They're very nice in combination, and just 2 different mechanisms.
Right.
It's the other natural remedies are stopping the adherence to the wall, but the key with the probiotic is that we're replenishing the bacteria. So,
right, exactly.
Do you recommend for a specific amount of time, or daily, or for infinity?
I mean, I think, again, it depends on where you are in the process. If you are being treated currently for an infection, actually twice a day is okay. You can also do it once a day, but I think a lot of us would say twice a day for probably 2 weeks or so. And then you can go down to once a day. And I would say I would do it probably for 3 to 6 months to really get things back in order. But again, this is going to depend on a lot of things too, right? Because let's say you're perimenopausal, so you've got an ongoing pH issue. Let's say you're postmenopausal. Let's say, like we talked about, you have another medical issue going on here. Of course, the other thing you can do, and you should do, is you really need to be looking at your hygiene routine, which should be pretty much nothing, okay? Like, your regimen should be warm water. That's about it. I don't want people putting stuff in their vagina. I don't want people wiping themselves with things. And I don't care how natural someone told you it is. I don't care how it was marketed. That stuff is evil, and it is literally stripping the normal bacteria, the normal oils, all the protective layers that your body is trying to make from the environment. So baby wipes, no, that's a big one. People do that. I think most people know that, like, hygiene products, anything scented,
Right.
soaps, douches are really not only not necessarily, they're not safe. But I guess I can't say it too many times. Yeah, exactly. Leave your vaginas
That's
alone.
good.
I mean, well, you don't have to leave them alone,
No.
but don't use this. This
Yeah.
is not it. So yeah, less is more, folks. Less is more. So lifestyle is very important. The other thing that I saw a huge uptick of problems during the early lockdown phase of the pandemic, because people were like sitting in their yoga pants on their couch, working from home, not moving. And I think all the trapped moisture and heat wasn't a happy situation for some of us and our vulvas. So I don't know. There's not a lot of like really good data on that one, but I definitely have seen it. And some people are just more susceptible. Some people can go to hot yoga and wear those yoga pants all day and drink 4 cups of coffee and never have a vaginal infection. And some people, they do it once and they've got a bladder infection. So, most of you know your body, or you will learn about your body, and your body will tell you, if you listen to it, what it does and doesn't want you to do. Most of this is common sense, and we are here to just support with some, natural-based, science-backed remedies.
Yeah, that's a good point. When you speak about like hydrating, drinking coffee versus hydrating. When I read your book, I was interested in, especially the section on genital urinary where it was like called GSM. I've never heard that term before.
Yeah.
But there was a good section about like lubrication, secretions, but Dr. Lenz brings up a good point that like when we think of just about foundational health, you know, lifestyle modifications, but like hydration, like obviously if some people drink coffee or other caffeinated beverages and not get an infection, but yeah, staying hydrated is good for the secretions as well.
Absolutely.
Or what's left of the secretion.
Because we're putting, yeah, and these tissues, especially these delicate tissues in the vagina and the urethra and the bladder, there are mucosal tissues. Okay? So they make mucus. They are, if you look on the inside of your mouth, it's the same. That's pretty much the same kind of tissue that you have in the vagina, the urethra, the bladder. So they are very delicate. They need to stay moist. And that is a very important part of their protective mechanisms. So when we don't hydrate properly, I mean, where's that moisture coming from? You know, I think people know 75% of your body is, you know, water, but we've got to give it the water in order to move that fluid into the various locations. And then obviously your urinary tract, I mean, it is designed to release anything that your kidneys are flushing out of your body. But if you're not giving your body enough water to flush, stuff's going to get stuck there. So the tissue can get dry and delicate, which is what happens as we age with lack of estrogen. And the fluids, it's not everything, but it is extremely important. It's really basic stuff, but sometimes we just have to remember. We have to remember to take care of ourselves.
For sure. Yeah. For individuals who can't make their way to LA to see you, and maybe they're suffering with recurrent UTIs, or perhaps like it could be BV as well. Is there anything you suggest they do? Would it be safe for them to, you know, try Ultraflora Women's or anything else?
Oh, yeah. Yeah, I mean, I think that would be a great way to start, is to start with really understanding what the true hygiene is for your body, the basic foundational, like you said, lifestyle things that we need to be doing. This would be a great idea to start doing this and see if that has an impact. And then looking at physician locators for organizations like International Society for the Study of Women's Sexual Health. Excuse me, or ISSM, which is the actual international. It's weird. And I can give those to you if you guys want to tag them, because people who have been trained in sexual health often are really adept at the more thorny chronic issues. So especially if you're having chronic issues, it can be very, very hard. Maybe your general physician or your general OBGYN just really doesn't know what to do. If you think you're being overtreated or undertreated, that's a great way to look. I think also the Menopause Society menopause certification program, those people generally are pretty good. But honestly, the sexual health books, this is squarely in their wheelhouse. A lot of people do telehealth around this as well. So that can be really important, because it can be very, very disruptive, like we said, and very lonely. People feel like there's something wrong with them, why they're not getting help, you know, script after script, and nothing's changing. So yeah, I love this idea of people taking it into their own hands and then getting resourced in a way that is going to benefit them.
Yeah, and if you are on the call and you are on a standing script, you want to take some power into your own hands. We do have Metagenics Institute, which is a non-branded website where there's like an abundance of information, and you can find the data on these two bacteria there. So again, it's Lactobacillus reuteri RC14 and Lactobacillus rhamnosus GR1. We can definitely also pop that on Instagram in the chat, so they could look for that information.
Yeah.
You could print it off, take it to your doc if you want to show them. But we will pop a code in as well if you want to like head over to metagenics.com and just purchase Ultraflora Women's yourself and try it. But we do have the data available for any of you that are interested in looking into that as well.
Yeah. That's great. I love that. I would love for people to kind of leave their comments and let us know what their experiences have been, or you know, if they want to come back, because we'll end up posting this, and you know, let us know what's going on with them now and in the future. That's always very helpful for us to hear people's experiences, you know, part of that.
Sorry, go ahead.
Yeah, that's it.
I don't know if you want to take this one, but I'm going to ask you anyways. For individuals who might be taking a probiotic, like just a GI probiotic, if they're wondering if that would help for urinary or general urinary
Not
tract?
necessarily, because the fact is, like, when we look at this product specifically, as I discussed earlier, lactobacillus, for instance, is a large category. And we know that the gut microbiome, the skin microbiome, the upper GI versus the lower GI, there's different areas that have different preponderance of bacteria. So there isn't like a probiotic that's going to fix everything. And I think if you understand what the microbiome actually is, then it makes better sense, right? It's like using a hammer for a nail, but a screwdriver for a screw. Like, they're not the same thing. They're all tools, but they're not the same, not going to do the same thing. So if you're taking a gut probiotic and you're not feeling better in the genitourinary region, it's because it doesn't have the right probiotic in it. And again, specifically when we talk about these particular blends, these have been studied extensively and shown to do what we're asking it to do, right? I don't know, and the other thing I think happens is supply chain issues, to be honest. Like, I'm always really wondering, how long has that been sitting in the CVS warehouse? And with all due respect to CVS, I just
Yes.
feel like these things have to be able to live. So that's a little bit important as well.
Yeah, you bring up another good point. I'll just mention that these are human strain probiotics. A lot of quality testing goes into the manufacturing of the product. We're going to make sure that the bacteria that are being ingested in the capsule that you're ingesting are going to make their way down to the urinary tract and get to the area of concern. And so testing is done to ensure that stability is taking place. So Dr. Lenz already mentioned, like, essentially the quality piece, and the research was, two reasons why I think she loved Metagenics. Any other reason, like, why Metagenics, Dr. Lenz?
You guys are so fun.
That's good.
I mean, do I need to have other reasons? I mean, I think listen, when I'm looking at a tool that I want to employ for my patients or for myself, I want it to be effective and safe. Period. End of sentence. That's it. I want it to do what we need it to do. I want it to do it without a lot of difficulty. This is not hard to do. This is not like super fancy dosing and complicated and changing all the time and do this and stop and start. I mean, nobody has time for that, right? So they're well tolerated. And I think the clincher for me is the data. It really, really is. It works. I've seen it work with my patients, and I like your studies. Your guys' studies are clean. They make sense, and they have impact. That is it for me. And as I mentioned at the top of the conversation, I mean, I'm always looking for complementary options for people. Not just because it's like funky or cool. Let me just say that. Like, I think that there's reasons why thousands of years of human history has included our interaction with the natural world, and even pharma. Like, probably 30% of pharmaceuticals come from the plant world. Mm-hmm. So if you have conventional doctors that are calling this snake oil or woo or not science-based, it's not accurate. And also they need to check themselves, because they don't actually clearly know very much about their own medicine that they're prescribing, because it didn't just drop into somebody's brain and they made it up. Most of the time it's coming from indigenous populations. That's a whole other IG Live about how inappropriately we address culture and the colonialism and supremacy, honestly, that is frequently involved in the criticisms. I mean, people should criticize things that don't have evidence to support them, but I think people need to, you didn't know this was going to get political, did you? People need to
I knew it. I'm not sure if our viewers are, but that's what I love about you. There's a time and a place, and you make it part of the place. There's a time to get serious about science. We need to get more serious about science.
We need to get more serious about science, and we need to be a lot more respectful of where this stuff comes from, and we need to be a lot more grateful and a lot less myopic. So I'm all about it. This stuff works. This stuff brings us closer to our own authentic selves. It restores our health. It helps us thrive. And I do love the kind of respect for the natural world and traditional healing practices with this modern twist. So I think I didn't know what my answer was going to be.
That was all great. And Yeah, and let's face it, I mean, the conventional world, there's a time and a place for the pharmaceuticals, but there is an abundance of women who need this formula. They need this product. Again, whether it's in combination with antibiotics, that's fine. But either way, we need to be supporting them and the microbiome for this.
Exactly. All right, I could go on and on forever, but I can't.
Yes. So we'll just wrap it up. Dr. Lenz and I chatted about general urinary symptomology tonight, what we could do to support UTIs, BV, postmenopausally. We might see this as well in women. The product we were chatting about was Ultraflora Women's. It's 2 lactobacillus in particular strains that are not only going to have mechanisms to kill off bad bugs, but also replenish the microbiome in the general urinary area. Anything else?
No.
Dr. Lynn, you want to?
Oh, thank you for doing this, and thank you for creating the opportunity to educate people and creating products that are so wonderful and effective. Somebody asked if there's a discount.
There
Sounds
is.
like you guys give a discount.
Yeah, so I'll pop it in the chat right now.
Yeah.
The code that ends in P for Paul is for the practitioners. The first code is for just customers that want to try Metagenics products. We'll also post it on Instagram as well. I just want to do a plug for Dr. Lenz. Get her book.
Oh, yeah.
It was such a great read, but also like such an easy read. It was definitely written for all of you on the call, for sure. You don't need to have a medical degree to read this book. In fact, like that's exactly.
It's really not. It's for the public.
Yeah.
It's for the public. And for those who are called to want to do their own menopause boot camps, which is how this whole book started and this whole momentum and movement started, there's a certification program. So you can reach out to me and we can give you more information on how you can create your own menopause boot camp facilitation experiences. So to get the word out.
Yeah, and for you to take control of your health, ladies.
Absolutely.
The time is now to speak up, for sure. So we're back next month with actually Charles Sirhan speaking about inflammation and SPMs, July 12th. And I think that Dr. Lenz, we'll probably see you again. I hope.
I hope so.
Talking about menopause a little bit more.
I'd love to. I'd love to. Thank you so much.
Thank you so much.
It's always so good to see you and work with you. And thank you everybody who's logged on and watched.
Yeah.
We appreciate it.
Have a good night.
All right.
Take care.
It easy.
Bye.
Bye.